There's a pill in your medicine cabinet right now. You've taken it hundreds of times, maybe thousands. You took it last week for a headache. You took it yesterday for that ache in your knee. You bought it without a prescription, without a second thought, probably without even reading the label. And if you are over 60, that pill may be quietly damaging your heart, destroying your kidneys, and undoing the very medications that are trying to keep you alive. I'm not talking about something rare. I'm not talking about a new drug with unknown side effects. I'm talking about one of the most commonly used medications on the planet. It's in every pharmacy, every grocery store, every bathroom drawer in the country. And most people over 60 have absolutely no idea how dangerous it becomes after a certain age. I'm Dr. Kevin Adewale. I'm a cardiac surgeon. I've spent over 20 years in the operating room, repairing hearts that were damaged by things my patients never saw coming. And I can tell you this, some of the most preventable cardiac events I've witnessed, some of the most avoidable tragedies I've seen in recovery rooms and waiting rooms at 3 in the morning were connected, directly or indirectly, to this pill. Tonight I'm going to tell you exactly what it is, exactly what it does inside your body after 60, and exactly what you should be doing instead. This is information that could keep you out of my operating room. Stay with me. The pill in every home. The pill I'm talking about is ibuprofen. You know it as Advil, Motrin. You may also know its close relatives, naproxen, sold as Aleve, and diclofenac, sold as Voltaren. These all belong to a class of drugs called NSAIDs, non-steroidal anti-inflammatory drugs, and they are everywhere. Estimates suggest that more than 30 million people take NSAIDs every single day, and they account for roughly 60% of the entire analgesic market. Among people over 65, the numbers are staggering. Studies have found that approximately 70% of people aged 65 and older use NSAIDs at least once a week. Nearly half of them take 7 or more doses per week. And 90% of all prescription NSAIDs go to people over 65. Here's what makes this so dangerous. These medications work beautifully for what they're designed to do. They reduce pain. They reduce inflammation. They bring down fevers. For a young, healthy person taking them occasionally, the risks are genuinely small. But the body you have at 65 is not the body you had at 35. And what was a safe medication in your 30s becomes a fundamentally different chemical exposure in your 60s, 70s, and 80s. The physiology has changed. The margin for error has changed. And the consequences have changed dramatically. Let me show you exactly how. What this pill does to your heart. In 2015, the United States Food and Drug Administration took an unusual step. They strengthened their warning on every single non-aspirin NSAID on the market. Not a quiet update buried in small print. A formal public strengthening of their cardiovascular safety warning. The updated labeling now states clearly that the risk of heart attack or stroke can begin as early as the first weeks of NSAID use, and that the risk increases with higher doses and longer use. It also states that even people without pre-existing heart disease or risk factors face increased risk from these medications. This wasn't a precautionary measure based on limited data. This was the result of more than a decade of accumulating evidence that began with a drug called Vioxx. Vioxx was a specific type of NSAID called a COX-2 inhibitor. It was wildly popular. It was prescribed to millions of people for arthritis pain. And then the data started coming in. During the 5 years it was on the market, Vioxx was estimated to have caused as many as 140,000 heart attacks in the United States. It was pulled from the market in 2004 in one of the most significant drug safety events in modern history. That was the moment the medical world started looking much more carefully at the entire NSAID class. And what they found was sobering. The cardiovascular danger was not limited to Vioxx. It was present, to varying degrees, across all non-aspirin NSAIDs. A major analysis coordinated by researchers at the University of Oxford, reviewing more than 750 studies, found that high doses of diclofenac and ibuprofen increased the risk of major cardiovascular events, including heart attack, stroke, and cardiovascular death, by approximately 1/3. That is not a subtle statistical signal. That is a 1 in 3 increase in the risk of a catastrophic cardiac event. How does this happen? NSAIDs work by blocking enzymes called cyclooxygenases, COX-1 and COX-2. Blocking these enzymes reduces pain and inflammation, which is the entire point of the drug. But those same enzymes are involved in maintaining the balance between blood clotting and blood flow. When you suppress them with an NSAID, you can tip that balance toward clot formation. And for a person over 60 with any degree of arterial narrowing or plaque, a clot forming in the wrong place at the wrong time is the exact mechanism of a heart attack or stroke. Unlike aspirin, which also blocks COX enzymes, but in a way that actually prevents clotting and is used protectively for the heart, non-aspirin NSAIDs push the cardiovascular system in the opposite direction. They promote the very conditions that lead to the events I spend my nights trying to repair. The silent attack on your kidneys. Now, the heart is not the only organ under assault. And what I'm about to describe is something that most of my patients have never heard of, even though it's happening in their bodies while they sleep. Your kidneys depend on a group of chemical messengers called prostaglandins to maintain blood flow through their filtering units. These prostaglandins keep critical blood vessels in the kidney dilated, open, allowing blood to pass through the filtering system efficiently. This is how your kidneys regulate fluid, electrolytes, and waste removal every second of every day. NSAIDs suppress prostaglandin production. That is their mechanism of action. But when you suppress prostaglandins in the kidney, those blood vessels constrict, blood flow drops, the filtering capacity decreases. And in a person over 60, whose kidney function has already declined naturally with age, that reduction in blood flow can be enough to trigger acute kidney injury. Research has found that the risk of acute kidney injury increases meaningfully in NSAID users over 65, and this risk is dose-dependent. Higher doses carry significantly greater danger. One study of over 121,000 new NSAID users over 65 found the relative risk of acute kidney failure was more than doubled across multiple types of NSAIDs. But here is where it becomes truly alarming. And this is the part that I need every single person watching this to understand completely. The triple whammy. If you are over 60, there is a good chance you take medication for high blood pressure. Statistically, more than 60% of people in that age group do. Many of those people are on a combination of two very common classes of blood pressure drugs. A diuretic, which reduces fluid in the body, and either an ACE inhibitor or an ARB, which relaxes blood vessels by blocking the renin-angiotensin system. That combination is standard. It's effective. It's prescribed every single day in clinics all over the world. Now imagine that person, on those two blood pressure medications, develops a headache, or their knee flares up, or their back hurts after gardening. So they walk to the medicine cabinet, take 2 ibuprofen, and go to bed. No prescription needed. No doctor consulted. No thought given to it at all. What they don't know is that they have just created what nephrologists call the triple whammy. The diuretic is already reducing fluid volume in the body, which means less blood flowing to the kidneys. The ACE inhibitor, or ARB, is already relaxing one of the key blood vessels that controls kidney filtration. And now the ibuprofen comes in and shuts down the prostaglandins that were the kidney's last remaining line of defense for maintaining adequate blood flow. 3 medications, each safe on its own, each prescribed or taken for perfectly reasonable purposes, converging on the same organ at the same time, from 3 different directions. The kidney's blood supply is effectively strangled. Researchers at the University of Waterloo modeled this exact drug interaction and found that the triple combination was linked to a 31% increase in the risk of acute kidney injury, which in some cases can be permanent. This is not a rare scenario. This is millions of people every single night, reaching for a bottle of ibuprofen, without knowing that the 2 medications already in their system have turned that pill into something entirely different than it was when they were 35. Undoing your blood pressure medication. There is yet another layer to this that most people never consider, even without the kidney danger. Even if your kidneys handle the ibuprofen fine, NSAIDs directly interfere with the effectiveness of your blood pressure medication. NSAIDs cause the body to retain sodium and water. They increase fluid volume. They raise vascular resistance. The result is a measurable increase in blood pressure, typically between 3 and 6 millimeters of mercury, and sometimes more. That might sound small, but for someone whose blood pressure is being carefully managed with medication, that increase can be the difference between controlled hypertension and a dangerous spike. Moreover, NSAIDs specifically reduce the effectiveness of several classes of blood pressure drugs, including ACE inhibitors, ARBs, diuretics, beta blockers, and calcium channel blockers. In practical terms, the ibuprofen you took for your headache may be partially canceling the medication your doctor prescribed to keep you from having a stroke. And here is the part that should make you sit up. Your doctor may see your blood pressure rising at your next checkup and respond by increasing your medication dose. Now you're on a higher dose of a blood pressure drug, plus taking ibuprofen occasionally. And the cycle continues. You're being treated for a problem that a pill in your medicine cabinet is creating. The bleeding risk nobody mentions. I've focused on the heart and the kidneys because that's my world. But I need to mention one more danger that is especially relevant to people over 60, because it's the most common adverse event from NSAID use, and it can be life-threatening. NSAIDs block the COX-1 enzyme that protects the stomach lining. Without that protection, the stomach becomes vulnerable to its own digestive acid. The result can be peptic ulcers and gastrointestinal bleeding, often without any warning symptoms at all. In older adults, NSAIDs have been shown to increase the risk of fatal peptic ulcers by nearly 5 times, and this risk is dramatically amplified if the person is also taking a blood thinner like warfarin, an anticoagulant, or even low-dose aspirin, which a large percentage of people over 60 are. NSAID use causes an estimated 41,000 hospitalizations and 3,300 deaths among older adults in the United States every single year. Those are not small numbers. Those are people who took a pill they assumed was safe because it didn't require a prescription. What you should do instead. So let me be practical. Because I don't want you leaving this video afraid to treat your pain. I want you leaving with a plan. Pain is real. Arthritis is real. The need for relief is real. But the way you get that relief after 60 needs to change. First, if you are over 60, Stop treating ibuprofen, naproxen, or any NSAID as if it were harmless. It is not. Every time you take one, your heart, your kidneys, your blood pressure system, and your stomach lining are being affected. That doesn't mean you can never take one. It means you need to treat it with the same seriousness you treat a prescription medication, because at your age, it carries prescription-level risks. Second, the safest over-the-counter pain reliever for most people over 60, if one is needed, is acetaminophen. You know it as Tylenol. It does not carry the cardiovascular risk, the kidney risk, or the stomach bleeding risk that NSAIDs do. It has its own limits, primarily liver toxicity at high doses or with alcohol, but for most older adults, it is a significantly safer choice for routine pain. Talk to your doctor about whether it's appropriate for you. Third, if you take blood pressure medication of any kind, especially a diuretic combined with an ACE inhibitor or ARB, you need to treat ibuprofen and all NSAIDs as a medication interaction risk. Do not take them without talking to your doctor first. This is not an overreaction. This is informed self-care. The triple whammy is real, it's common, and it's dangerous. Fourth, explore non-medication approaches. For joint pain and arthritis, physical therapy, gentle exercise, weight management, heat and cold therapy, and topical treatments like diclofenac gel, which is absorbed locally and carries lower systemic risk, can all provide meaningful relief without sending a pill through your bloodstream to every organ in your body. Fifth, if you genuinely need an NSAID for a flare-up or acute pain, use the lowest dose for the shortest possible time. That is the specific language the FDA uses in their guidance. Not lowest dose forever, lowest dose for the shortest time needed. Days, not weeks, and absolutely not months. The conversation you need to have here is my final point, and it's the one that matters most. If you are over 60 and you use ibuprofen or any NSAID regularly, meaning more than once or twice a month, you need to have a conversation with your doctor that you have probably never had. You need to ask specifically whether your current medications interact with NSAIDs. You need to ask about your kidney function. You need to ask about your cardiovascular risk. And you need to ask what the safest pain management options are for your specific situation. That conversation takes 5 minutes. And it is vastly more important than anything I can tell you in this video, because your doctor knows your body, your history, your blood work, and your medication list in a way that no video can. What I've seen, I want to be honest with you for a moment. Not as a content creator, as a surgeon. I have operated on hearts that were damaged by clots that formed during chronic NSAID use. I have seen kidney function reports in preoperative workups that showed acute injury from a drug the patient bought at the grocery store. I have spoken with patients in recovery who had no idea, absolutely no idea, that the pill they'd been taking every night for their arthritis was raising their blood pressure, undermining their medication, and quietly loading a gun that eventually fired. These weren't reckless people. These weren't people who ignored their health. These were careful, thoughtful people who simply didn't have the information. They assumed that because a drug is available without a prescription, it must be safe for everyone. And that assumption, that very reasonable-sounding assumption, is one of the most dangerous beliefs in medicine today. You now have the information. The question, as always, is what you do with it. Now I want to ask you something directly, and I genuinely want you to answer in the comments below. How many of you have a bottle of ibuprofen in your home right now? How many of you take it regularly? And how many of you have ever been told by your doctor that it interacts with your blood pressure medication or poses a risk to your kidneys? I have a strong feeling the answers to those questions will tell a powerful story. If this video helped you, share it. Share it with someone over 60 who reaches for ibuprofen without thinking twice. Share it with a spouse, a parent, a friend who takes blood pressure medication. This is exactly the kind of information that never comes up in a routine checkup but could genuinely save someone from a preventable disaster. Take care of that heart. It's been working for you every single minute of your life. Don't let a pill you bought for $2 undo everything it's been fighting to do. One last thing. Everything I've shared here is general medical information based on current cardiovascular research and my own clinical experience. It is not a substitute for your personal medical care. Before you stop or change any medication, including over-the-counter medications, talk to your own physician. That's not a legal disclaimer. That's genuine advice from someone who wants you watching this channel, healthy and well, for a very long time. Good night. Check that medicine cabinet. Take care of yourself.